This is a presentation that I gave at the 2019 MSRT annual meeting. It was originally 100 minutes long. I've broken it into 4 modules to make it more palatable for an online audience. This module contains the material that describes the basic behaviors of X-radiation that makes collimation both necessary and possible. Before we begin the discussion of radiation behavior, let's consider 3 questions that pertain to X-ray behavior. I'm sure you've heard of the concept of dose creep as it relates to digital radiography. Of the 3 items listed, which contributes to dose creep? I'll give you a moment or two to contemplate the answer. If you answered all items contribute to dose creep, you're correct. While when in doubt, burn them out has been quietly practiced in imaging departments across the country, it is an excuse used by incompetent practitioners. We have seen digital systems fix or correct grossly overexposed images. Next, many radiographers use lower kV and higher MAS techniques, with the mistaken notion that it will enhance contrast. Contrast is corrected in image post-processing, and the low kV is no longer a big factor in producing a high contrast image. Finally, collimation errors are less noticeable because of masking and post-processing image manipulation of the radiograph. So all 3 contribute to excess patient dose in the digital environment. The next question points to a common misperception regarding X-radiation. I'll give you a minute to consider the answer. Item A is commonly thought to be the answer. It is not. X-rays cannot be directed or redirected. When the X-ray beam is produced within the X-ray tube, X-rays travel in all directions. Only rays used to produce the image are those that exit the tube port. The only reason for the existence of the anode angle is to control the effective focal spot size. The effects and controls of the effective focal spot is a presentation to give it another time. If dose reduction is the goal of most radiographers, which method is most effective? Let's take a minute to consider the answer. If you answered repeat reduction, you are correct. I know you thought this presentation was about collimation. If it is some consolation, collimation is the second most effective means radiographers can use to reduce patient dose. Now, let's take some time specifically to list X-ray behaviors that relate to collimation. X-rays cannot be focused. Unlike visible light, X-rays cannot be made to converge or focus. X-rays cannot be refracted. They cannot be divided into bands of distinct energies, even though all X-ray beams contain rays with different energies due to Bremsstrahlung interactions. Like light in a mirror, X-rays cannot be reflected. X-rays can be scattered, which means they change direction, but only in a random fashion. In a mirror, the angle of incidence is equal to the angle of reflectance, which means that light reflects in an orderly and predictable manner. Bottom line, one cannot change the direction of X-rays in any predictable pattern. X-rays can be confined. This is accomplished by the lead housing that surrounds the X-ray tube. While the X-ray beam is produced in all directions, it is restricted by the lead that surrounds the tube. X-rays that are allowed to escape confinement are ones produced in line with the hole in the housing called the tube port. The remaining X-rays are absorbed by the lead in the housing, and their energy is converted to heat by interactions with the atoms in the lead. X-rays are emitted by the focal spot and travel in all directions. This unshielded X-ray tube literally fills the room with primary radiation. If we add a lead housing to the tube, things become more orderly and the radiation will be confined. When the X-ray tube is fired again, the radiation is confined by the housing. A divergent cone of radiation is allowed to escape via the tube port. Another important characteristic is that most forms of electromagnetic radiation will spread or diverge from their sources. While X-rays diverge from the source, they do travel in straight lines from the focal spot. It is the combination of their divergence, nature, and traveling in straight lines that accounts for image magnification and the inverse square law, both of which are still present in digital radiographs. Finally, X-rays travel at the speed of light, 186,000 miles per second, which explains why the run and dodge form of radiation protection is not recommended. This ends Module 1. In Module 2, we will consider the professional and ethical reasons for maintaining tight and accurate collimation. Thank you.